This is Bedwyr, one of hundreds of children and young people in Wales with a life-limiting condition who are given support by children's hospices here. The families who get this help describe it as a lifeline. Bedwyr's mum is one.
It means a lot because actually Bedwyr has some time out from us, but as a family we get to spend time doing things that we could normally do with Bedwyr because of his condition, his needs and so forth. So coming here gives us as a family time just to chill out, take time to ourselves, have quality time together and then recharge ourselves ready for the next few months that's coming up.
At a time when demand is growing, the two children's hospices in Wales, Gobaith and Hafan, decided the best way to reflect that need was to give the parents a voice, to let them speak. The results are in this report.
And families are the cornerstone of looking after children with life-limiting conditions. So 94% of families said that respite is essential. And then the shocking statistic is that even though most of those families have a statutory right to short breaks and respite, for over 80% of those families, the charitable funded hospices are the only source of respite care.
Families have described the hospices as their lifeline, and for them to be so dependent on a place that's so reliant on charitable funding, it's quite a scary thought really, and it just demonstrates that families couldn't function without the hospices.
James Meacham lost his son Thomas to a rare brain disorder, but throughout Tom's illness, Hafan was there.
They gave us hope, not hope that Thomas would ever recover, but hope that we could be a normal family during the times that he was in there having respite and we were there being looked after. These kids are terminally ill and they need, in my opinion, they need a lot more support than they're getting at the moment, just in terms of funding. I mean, we're talking like less than 10% central funding from government.
Our children's hospices gave parents a voice, and the hope is the world will listen. Ian Lang, ITV News.
Families that come to the two children's hospices in Wales have had their voice heard. It's often the case that it's professionals who talk about the needs of families and children and families, and this is really the first time that we've heard directly from the families what makes life better for them.
And why did you decide to go down that road?
I think it was really important when we are looking at caring for children and families that we understand exactly what makes life better for them. As a children's hospice, we're obviously here for end-of-life care, but our relationship with the family is from the point of diagnosis all the way through. And so we need to understand as organisations what we need to do to make the best for those children and those families. We also want that voice to be heard at the highest levels within Wales. So we're asking our partners, whether that is local authorities, the Welsh Government, health boards, to partner with us to make life better for children and families, for those children with life-limiting conditions.
I know you must have spoken to quite a few families. Is there an overall message that you've got from it?
Yes, we spoke to 130 families actually contributed to the study, which is an amazing response and much more than we had anticipated. So huge thanks to all the families that did feedback and give us their views. I think what really surprised me was that 94% of families said that respite was absolutely essential. Not a nice to have, but absolutely essential. For many of these families, going to the park, going to the swimming pool, going on holiday, perhaps even jumping on the trampoline in the back garden is impossible. And respite is a pale imitation of what we all take for granted. But it's so important for those children and those families. It keeps the families together, it improves their health, their mental well-being, their financial well-being, and often their relationship as a family. And families are the cornerstone of looking after children with life-limiting conditions. So 94% of families said that respite is essential. And then the shocking statistic is that even though most of those families have a statutory right to short breaks and respite, for over 80% of those families, the charitable funded hospices are the only source of respite care.
Why do you think it's important that you do this?
I was approached by Hafan on the back of this survey that's happened, and they asked me would I articulate my views on what families need from hospice services.
How has it helped you? How did they help you? in really dire, tragic circumstances. But how did they? What was it they offered? What did they give you? What's so important about what they gave you?
They gave us hope, not hope that Thomas would ever recover, but hope that we could be a normal family during the times that he was in there having respite and we were there being looked after. The emotional support, notwithstanding the physical support from a carer's point of view, it allowed you to stop being a carer and be more of a parent, especially because Thomas has a little sister called Ella, and you can't avoid the fact that when you got somebody who's as ill as Thomas was, it takes a lot of attention, it takes a lot of focus, and it takes a lot of energy as well. So when you try and strike a balance with, like Ella was only 4 or 5 at the time, so a child of that age takes a lot of focus as well. So you have to try and be fair. So when you got the help of a facility like Hafan, who can offset some of that and allow us just to be normal parents rather than carers as well. I can't put that into words. You can't quantify that.
And it's so important the way they've done this report, because it is the voice of the parents, isn't it? That's what's different about this report, because usually it's chief executives and senior officers. This is the parents speaking from the heart, isn't it?
Yeah, there's a place for all that. There's a place for those official statistics and the corporate sound bites, as it were, but nothing really drives the message home than getting a parent's perspective. And it might not be as eloquent or articulate as the CEOs you're going to speak to, but I think this is a much more real message.
I mean, they seem to be I think they've taken the stand that they don't want to do what some organisations understandably do, say crisis, crisis, crisis. But you can see they're worried about the future.
Yeah, they are. They are worried about the future, and rightly so, because and everybody's fed up with the word now, pandemic, but it's had such an impact on the charity's ability to support families. I mean, they've been open for crises and end-of-life care, but the regular respite services and all the other things that they offer families like mine, they haven't been able to do in the last, since the lockdown started. So I honestly don't know how we would have coped, and I take my hat off to families who are going through it now and have children who are as ill as Thomas was, but having this, reduction in help from Hafan, because it's mind-blowing how difficult it is.
And it really is a question. I mean, what they're asking is I mean, it's I think it's to be between the two, it's 7 million a year, isn't it? So that's incredible work done in fundraising that amount of money. But there are other partners as well who could help. Council, social services, I suppose, and it's a bit of an appeal, isn't it? I think
it is an appeal, and you're probably more aware than I am that the importance of funding. But when I can only speak from my own experience, when Thomas was ill, we had help from the local paediatric community nursing team. They were fantastic. They used to give us respite cover in the nights, but you're still on duty at the time as a parent. They would work from 10 p.m. till 7 a.m. So it would allow you to sleep and recharge your batteries, but it doesn't compare to the respite that you would get from Hafan when the child was there physically. You had the option of staying there and being looked after, or coming back home and just trying to relax in what is a really difficult environment, because you're surrounded by medical equipment and constant reminders of the illness. So it is really hard. But yeah, to answer your question, there's no other real agency apart from the community nurses, and they're restricted in what they can do in the current climate.
And Hafan, I mean, I know Hope House very well, because I was involved in starting it up many years ago. Newspaper reporting, we ran a repeal with Hafan. What's a little bit of the background about that? How old is that? Because I haven't done any stories on Hafan. So
Hafan was established around 20 years ago. I think they're in their 20th year now, so that's why they're fundraising for a refurbishment, which they are progressing through, COVID allowing. But yeah, before the hospice was established, there wasn't anything for, I hate this phrase, but paediatric palliative care, because let's face it, it just shouldn't exist in the first place, but it does. So yeah, it's only been around since the early 90s. And it was, I can't remember the lady's name now, but it was a brainchild of a Suzanne Goodall. It was her intention. She fundraised for it. She got the profile raised, and yeah, it's kind of grown from there.
Oh, right, okay. So as I say, it's vital. Like I said, in COVID, with Brexit, it's very easy for all, you know, the incredible work that both the charities do to slip out of people's minds. That's the danger, isn't it? Because people tend to, you know, people having to deal with COVID, Brexit's another thing, and you can easily forget just the needs of, as the chief executive of Hope House said, you judge, a country is judging how it treats its children.
It is, and it's a bugbear for everyone who uses the Hafan and indeed the other children's hospices in Wales, because everyone I've spoken to who has been impacted by, in particular, Thomas's story, and I'm talking friends, I've taken colleagues to the hospice, you know, for corporate volunteering days. Everyone, to a person, has been shocked by the lack of funding that they receive. I mean, we're talking like less than 10% central funding from government. And you mentioned the country's judge on how it treats its children. These kids are terminally ill, and they need, in my opinion, they need a lot more support than they're getting at the moment, just in terms of funding.
And the public need to be aware of that. That's what hopefully the report.
Yeah. It falls to fundraisers, whether that's corporate fundraisers or family and friends fundraising. I mean, I'm doing a charity cycle ride in March, COVID permitting, called Ride to the Rugby, which is raising money for Tiavan. I've done the last 2 rides, and over the last 2 years, and having someone like me on the as part of the riding group, and being able to tell the story of what Hafan means to a wider audience, and then all those riders go off and tell their families, because they've had first-hand experience of this, what the money they raise does. It's so powerful. It's incredible. But in a perfect world, we shouldn't have to do it.
No, I agree.
We shouldn't have to do it. And yeah, these kids and these families, they deserve more than the funding from the government that the hospice gets.